ChatGerry, my 40-year health journey of obesity, diabetes, and vascular damage number, 1361, September 20, 2025. Gerald C. Shu, EclaireMD Foundation. Category, Metabolism. Over the past 4 decades, my health journey has shown how obesity and type 2 diabetes, T2D, can silently and steadily damage the body's blood vessels, leading to a chain of serious complications. I became obese in 1985 at age 38, with a BMI of about 30. By 1990, I was diagnosed with T2D. Within just a few years, I had my first 2 heart episodes, showing how quickly high blood sugar and insulin resistance could harm my arteries. In 1995, I fainted at Hong Kong airport from hypoglycemia, an early sign of autonomic nerve dysfunction. The early 2000s brought more heart problems and dangerously high glucose levels. Between 2007 and 2010, things worsened. I developed severe neuropathy with a foot ulcer, retinopathy in my eyes, and nephropathy. With the urine ACR above 1160, a clear sign of kidney failure risk. At that point, most patients would have relied heavily on medications. Instead, I made a different choice. Starting in 2010, I shifted to strict lifestyle management. I stopped all medications and focused only on my lifestyle. Moderating food intake, especially carbohydrates and sugars, walking about 15,000 steps a day, improving sleep from 5 to 7 hours, and learning, not always successfully, to manage my emotional stress conditions. This choice became a turning point. From 2014 to 2024, with systematic daily health tracking on my developed medical AI system, my hemoglobin A1C dropped from around 12% to 6% and my BMI from 32 to 24, all without medication. During this period of 11 years, I had no new complications. However, lifestyle changes cannot undo permanent structural damage. On my vessels, my arteries and microvascular vessels already carried decades of calcification and stiffening. On June 21, 2025, after an emotional dispute, my blood pressure surged to 175 mm of mercury, rupturing a fragile vessel near the pons in my brain. This hemorrhagic stroke was followed by 2 seizures. This experience confirmed for me that vascular damage is the common root of most deadly diseases, around 50% of all cases, and diabetes is the fundamental driver. The lesson is clear: lifestyle can stabilize disease and even extend survival, but delay in lifestyle intervention leaves irreversible scars. Disclaimer: this content is provided for educational reference only, and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C. Shu.